This book may serve as a cornerstone to the psychedelic-assisted therapy field at this time. This essential contribution offers a depth-oriented, somatic, and relational therapeutic approach, emphasizing the imperative of ethical standards, the relevance of the therapeutic use of touch, the significance of the unconscious in symbolic meaning-making and intersubjective processes, and the necessity of trauma-informed approaches, all while centering liberation psychology and decolonial practices. The topics addressed in this book and the themes embraced by the authors are of great relevance and not yet comprehensively articulated in existing publications on psychedelic-assisted therapy. The diverse authors of this book approach their chapters grounded in their diverse social and cultural identities, as well as their extensive clinical experience providing psychedelic-assisted therapy in government-approved clinical research, private practice, and nonprofit organization settings. Their contributions are aimed toward a vision of psychedelic-assisted therapy centered in decolonial practices, attuned to the somatic, imaginal, cultural, and relational dimensions of being, allowing the emergence of transpersonal processes. Each chapter elaborates on practical and theoretical aspects of this treatment modality through a unique theoretical framework, providing inspiration and guidance to listeners working in this field, as well as those compelled toward psychedelic work for personal transformation. The editors of this book have been dedicated to this offering for years in their engagement with the development of the psychedelic-assisted therapy field as clinicians, researchers, educators, and visionaries. I worked alongside Dr. Jason A. Butler as core faculty in the Integral Counseling Psychology, ICP, program at the California Institute of Integral Studies in San Francisco. I had been teaching in ICP for 7 years when he joined the department, bringing his inspired contributions from depth and transpersonal psychology with a social justice focus and a special attention to the body and to community. Dr. Butler had published about social and cultural considerations in psychedelic-assisted therapy and was about to launch a pioneer clinic, Sage Institute, in partnership with his wife, Dr. Genesee Herzberg. Dr. Herzberg had been involved in conducting research in the Multidisciplinary Association for Psychedelic Studies, MAPS, clinical trials using MDMA for the treatment of PTSD, as well as manifesting her entrepreneurial prowess in opening her clinic for integrative health and psychedelic-assisted therapy, Sage Integrative Health in Berkeley.